when a patient comes to me complaining of unsatisfactory appearance of the body, for example, it's important to pinpoint exactly what is the dissatisfaction. That is the key. In other words, you establish what the patient is unhappy with and what it is that they're hoping to achieve. It's important to understand whether the issue is the amount of fat or the fat distribution, or whether it's excessive amount of skin, or a combination of any of those issues. Once you determine what the problem is and what is responsible for the problems, that is when you can formulate a treatment plan. Now, often the treatment plan is not one procedure. It is often a combination of several procedures that, taken together, will give the desired result. There is no doubt that, unlike many other medical professions, plastic surgery, and particularly cosmetic surgery, is a unique combination of art and science. This is definitely a science. There is a vast amount of research and a number of people working to improve cosmetic surgery techniques so that we can improve outcome for our patients. At the same time, I think a good plastic surgeons have a certain creative part of their personality, a certain artistic vision that they use to produce results for their patients. It doesn't have to be your ability to draw. Personally, I'm a very avid amateur photographer. Now, when you do photography for a number of years, you begin to develop a certain sense of aesthetic, of proportion, and you use that when you plan your cosmetic procedures. So that in the end, you combine the artist in you with the scientist in you to give the patient what they see. So plastic surgery is unique in medical specialties in that it requires a balance of scientific knowledge, artistic vision, and a good pair of hands.